Well, Dr. Pascal, thank you for being on my podcast, Share a Meal today. And I am so excited to have you on here and just kind of get a feel for what you do and how nutrition fits into it and how, you bring together this holistic approach and what does that really mean to the people who come and see you, your patients? What is that all about?
Right. Okay. There's a lot of questions in there, so I'll
I
try
know,
to
so go slowly.
I'll
Yeah.
try to break them all down. And so when patients come and see me, I am a dentist. I've been practicing dentistry for 25-ish years, but I'm also a naturopathic medical doctor. I'm board certified naturopathic medical doctor. So I try to merge all that when most of the clients that I see come to me because they've been to several doctors like naturopath, medical doctors, chiropractors, even other dentists, and they're having issues they can't resolve. And basically they come to me to clean their mouth. A lot of times it's for toxins. So there are a lot of toxins in the mouth people take for granted. They think it's normal to have, and it's okay to have, for example, silver fillings or metal things or infections that are kind of chronic quiet. And I'm habilitated to not just find all these things, but I have like biocompatible alternative that are more conducive, like for example, for your space, for clients to be more productive, more performance, like oriented, perform better. So a lot of my patients come for that. You touched on
The mouth is so important, is what you're saying. What happens in the mouth is very important and plays a role throughout your body. It's connected to everything.
It's completely connected. It's kind of it seems silly to think that it's not connected, but that's how we all view it. But it is very connected. A quick example that relates to nutrition is our biome. We're very familiar with our gut microbiome, and essentially the mouth microbiome is almost the same. They're connected completely. Whatever you have there, you'll have. So if you have parasites, you have a bad biome in your mouth, you'll most likely have a bad one in your gut. The reverse way, for example, would be if you have stomach issues, you're not digesting properly, it'll come back up, as in when you don't have a good when your digestion doesn't work properly, your stomach doesn't make as much acid, and acidity is what controls the valve that keep the content in the stomach. So if you don't have enough acid, the valves will open, the acid will come back up, and you'll have a tendency to have demineralization or cavities in your mouth. So those are just two examples, but it's very, very connected.
Yeah. So when you're talking about this with your patients, they're coming into you because other things have failed. Is that what you're saying usually happens?
Yes. So I have three groups that come to me. The majority, I would say 70%, come because, like you said, things have failed. For example, they have Lyme disease or mast cell activation, thyroid issues, and they can't quite get it resolved. So yes, they come to me and I help them. Did you know, for example, fluoride is very bad for the thyroid? We think, oh, fluoride to fight cavities in an era where we have other things to fight cavities, but in reality, your thyroid secretes T3, T4, which are responsible for energy, but T3 and T4 stands for 3 iodines on that T hormones and 4 iodine on that, and fluoride will displace that iodine on that hormone. So if you have symptoms of low thyroid function and you go get it tested, you'll have the right amount of thyroid hormones, but they're not functioning because the fluoride's instead of the iodine.
How do you spot that?
You have to go to a practitioner who's versed in knowing these things. And I'll tell you, Dr. Dardarian, the thyroid issues are becoming rampant. There's like more and more, like I see it in my office, like I hear every day Hashimoto, which is a thyroid autoimmune, but low thyroid functioning, because our diet, which you're an expert in, it is not what it used to be. We're more toxic than and that creates inflammation. And also the gut dysbiosis creates like more kind of autoimmune reactions. And so we see all the thyroid issues. But to answer your question, you would have to go see someone who knows how to truly test for that. The easy thing with that at the same time is that you can supplement with iodine. It's quite safe. If you take too much, you'll just excrete it. And if you take enough for long enough, it'll displace the fluoride back, and eventually, you kind of go back to normal. But just
Okay. I have a great question here.
Yeah.
Can I, because now I've got so many things that are like popping in my brain right now I need to ask you about.
Yeah.
And I'm going to ask you to remind me to cycle back to hydration. I want to bring that into it and how that plays a role in all this.
Sure.
But before I get to that, I want to talk about iodized salt, because you're bringing iodine into this. And
Yeah.
there's this whole trend out there right now of
Mhm.
all these specialty salts that do not have iodine in them. They are non-iodized.
Yeah.
And does that play a role? Like, can you simply go back to iodized salt instead of some of these specialty salts in some of your foods in order to add iodine back into your diet?
I wouldn't do that. I would get better quality iodine than, getting it with sodium chloride, which is devoid of many of the minerals that, you probably, I guess, would recommend with higher, better quality salt that we have these days. That's, that's what I would answer to that. You'd be, anyway, the quantity that you have in there in iodized salt is probably minimal to help with the iodine, and you wouldn't really know how much you're getting, i.e. if it's enough or not to do what you want it to do.
Mm-hmm.
So for that reason, I wouldn't go to that. And then the quality of the sodium chloride, compared to, salts that you would probably recommend, it is probably very low. I'm not a dietitian, that's your expertise, but in my humble opinion, you should have like a salt that has other minerals, and sodium chloride is not that.
True, but sometimes you just need sodium chloride, believe it or not, especially if you're an athlete,
That's true.
right?
That's
like
true.
with all the sweat.
Yes.
So just for maybe not the general population, but for the athletic population,
Yes.
we are looking for sodium, so
True. Okay.
it might fit that population only. We might not extrapolate that to the average healthy person who is looking for more minerals. Absolutely. Yeah. Okay. So one of the other things I was thinking is, you were talking about fluoride. Other than toothpaste, where do we get fluoride? Because not all water has fluoride in it, right? There's only pockets of places that have water that's fluoridated.
Right. There's still a lot of places that fluoridate their water. So you need to check with your municipality and see if they fluoridate your water or not, and you should know when these guys put that fluoride in the water, they're dressed in hazmat suits. So we're just talking about what fluoride does to thyroid, but it's a neurotoxin. There's been some like studies where overexposure actually causes like ADHD and like neurological issues. And I don't want to go down that rabbit hole.
Yeah.
But,
It's not.
It's
because that is also,
yeah, but basically, you'll find that in toothpaste. There's actually some in most floss. There's some in mouth rinse. You don't want that in there either. And in the water. Those are the main places where you'll find fluoride.
Could you get too much fluoride simply by brushing your teeth frequently?
Right. So you'll absorb some, where we can actually see that. So it's called fluoridosis, when there's stains in the teeth, because when your teeth were formed, too much fluoride was absorbed into the structures that compose the teeth, the enamel, for example. You can see either white spots. Sometimes if it's really a lot, you'll see brownish yellow spots in the teeth. And so that is too much. But typically that's because, if let's say kids will swallow some of that toothpaste. So no bueno, that's not good.
Okay, okay.
You can do that, yeah.
So is it only when you have too much fluoride that it starts replacing the iodine for the thyroid, or it's just even just having it in your system, not even, it doesn't have to be overflow?
So fluoride, if you look on a chemical element chart, fluoride is next to iodine. It's stronger than iodine. So any fluoride will displace the iodine, and then it becomes like a frequency and concentration. Sorry. So, I would personally avoid that. There's a big debate in the community. There might be some, listeners are like, oh, but what about, fighting decay, and that's another road maybe we shouldn't address today, but there's really fantastic alternatives to fluoride. You don't need to do that. And for
like what?
Well, there's a compound called hydroxyapatite. Nanohydroxyapatite.
Yeah. I've seen that places and I've wondered what that is.
Yeah, it's like a component of what your teeth are built of, and you can brush with that and it'll help you fight decay, just as well as or better than fluoride, because fluoride has secondary effects that are not good. But you can also be mindful, you hear about brushing, you hear about flossing and eating sugar, but the mouth biome is a really big deal too. In my office, sometimes patients will have perfect hygiene, perfect diet, and are still getting cavities. And, we'll look at what kind of bacteria they have in their mouth. So we'll do a DNA sample test. We have them spit in the vial to get that analyzed to see what kind of bacteria. And if they have too many that cause the bacteria, then we'll have a protocol to reduce the bad bacteria and increase the good ones with nanohydroxyapatites and some supplements to support the tissues in the mouth to fight decay.
Would you see that people who are more hydrated would have a better mouth biome?
I would say so. The mouth is the beginning of the digestive tube, and there's saliva production, which contains enzymes, antibodies, and things like that. And those help maintaining the good biome. So the more you have of the good saliva, the saliva flow, and that, it creates like a flow, a current in the mouth that makes things not stagnate. When they're stagnating too much, a lot of times the type of bacteria will shift to a bad one. So when you have more hydration, I would say, yes, that's conducive to a better, mouth environment. The flip side of that is we see a lot of breathing issues. I'm very attentive to airway dysfunction, nose, mouth, the airways behind the tongue and everything. And when people have dry mouth, it's very, very synonymous with breathing issues.
Breathing, meaning they breathe through their mouth mostly?
They're breathing through their mouth more than they're supposed to, or, breathing restriction, airway restriction, like the tubes are too small for the air to go. And so they have to breathe through their mouth. And sometimes the breathing is actually interrupted, which is sleep apnea, things like that.
Wait, so how do you teach somebody to breathe through their mouth at night, let's say, if they're a mouth breather at night, like, how do you approach that?
Yeah, that's a very good question. And it's a very important one.
And I'm not asking that at all because I do it. It has nothing to do with me. I just want you to know that.
I got it. You don't do it. But the reason I'm catching my breath is because there's a lot of things. Let's say there's a lot of stages to that. most of what we know, let's say, about not breathing well would fall into snoring or sleep apnea, which to me is like the end of the scale, the worst part of not breathing well. But even before that, there's a lot of restricted airway, or air not going through the nose and through the mouth. So to answer your question, we kind of have to know where you're at, because if you're having sleep apnea where you stop breathing anywhere from 4 or 5 times an hour to sometimes like you stop breathing every minute, I can't do the same treatment for you to breathe through your nose as, if you're just having a small issue. But to answer your question, I guess I would say if you're not suffering from, really bad sleep problems, I would do mouth taping, nose cones. It's why a lot of people use these like strips that kind of open the nostrils, but they're cones you can put in that just really open up the nostrils, and the airflow is incredibly increased. So it's literally mouth taping, nose cones. There, and then after that, it depends how bad the problem is. Like if you're snoring, you can do laser treatments to tonify the tissue, not burning, not cutting or anything. It's just like that low level kind of laser treatment where the light just makes the tissue so healthy, they're tonified, they don't collapse when you breathe. Sometimes it's a little bit worse and you have to like put appliances that pull the jaw forward. Sometimes you have to wear the mask if it's really, really bad. But
this is so interesting, and I just feel like it has nothing to do with nutrition, but I do like talking about it because I think
it's
a
a
lot
big
of people
deal.
are going through these things, and
Yep.
I mean it can loop into nutrition in a way, right? Because
Let me tell you
also,
how it loops. Sorry
yeah,
to interrupt
go
you.
ahead. Yeah, go
Let me
ahead.
tell you how it loops. So I don't know if you're familiar with Dr. Weston Price, but he's a dentist in the early 1900s who was a brilliant man. He basically traveled around the world in indigenous countries, and he compared nutrition here with nutrition there and pretty much how it affected cavities. But he found that it actually affected the growth of our jaws. So with the food, their nutrition in the indigenous country, the force that was used to masticate promoted the growth of the jaw so much that you would never see teeth misaligned, needing braces or anything like that. Wisdom teeth were never extra. And then relating to the breathing topic we just talked about, the mouth and all the apparatus, masticatory apparatus was so large, the way it's supposed to be, that we wouldn't have breathing issues. So nowadays, our food is considered, compared to back then, mush. Like
Yeah,
it's so soft.
right.
The force does not promote growth. So one of the problem is the teeth are misaligned, the wisdom teeth are extra, but when the jaw doesn't grow enough, if you think of the jaw as like a garage and the tongue as a car, the car doesn't have space to go in the garage anymore, so it gets pushed back. And then when it gets pushed back, it closes the airway in the back. So we have all kinds of airway issues, which leads to growth issues. Of course, you don't have enough oxygen because you're not breathing well. So, I'm seeing that in kids now. Like really young kids have already growth deficiencies, which they don't breathe well and they don't have enough oxygen. A lot of times we call that ADHD, when in reality, they're not getting enough sleep and oxygen when they're sleeping.
Right. This all makes perfect sense. I think that I was going to ask you about that, what we're eating in our diets and how that impacts our mouths and even the strength of our teeth, right? I mean, you need to be chewing things in order for your teeth. So you should have hard pretzels, for example, and we should not just be drinking smoothies all day. That's not what we were meant to be doing. We weren't meant to be drinking our calories. We were meant to be eating food and chewing, which also burns calories throughout the process of digestion.
Exactly.
And also anything that is a little bit harder to bite into, of course, most likely would have more fiber in it, right? So we're supposed to be eating fibrous foods and things that make us chew longer, chew harder. It all plays a role in your total
Yeah,
overall holistic self.
you got it right on. I mean, I doubt that most of humanity we had mushy food. It might have happened here and there, but we probably had to do our things really hard, which is like a really good point that it's very, a lot of fibers, very fibrous in nature, which was, helping, of course, with the whole
Well, I mean,
digestion.
they didn't have refined grains, right? Their
Yeah,
grains were non-refined, full of fiber,
right.
full of husks, psyllium, everything there.
Exactly.
So when you're
Yeah,
eating that, that does great for your mouth, but it translates into your body.
it
That
does.
talking about the gut biome, which you were just talking about as well, we know that fiber is the bottom of that pyramid. If you don't have enough fiber, then you're not creating an environment even for then probiotics to be functional.
Exactly. I mean, in the past 4 generations, we've seen changes in our diet, in our lifestyle, and that we've never seen so quickly and so much in humanity. And we just kind of take it for granted. But you're right on the money. Like it's
So let's bring this back a little bit, because I like what you said about this doctor who he went and traveled around and he looked at different
Mhm.
diets and how that impacted the mouth.
Yes, Dr.
That's
Price.
very similar to many of the people who have been researching blue zones, where those are
Yes,
the places of the earth where people live the longest, centenarians who not only live the longest, but live functioning
exactly.
the longest. So
Functioning is a really
yes,
good word. Yeah.
functioning is the word. So they are still walking and they are doing things that make them live this longer, better life than other places. Now, there aren't that many places of the world that live this way.
Correct.
I was lucky enough to go visit one of them this summer, Ikaria, Greece, and it's very, untapped. They are walking a lot, they are eating together a lot, and they are making foods that are like what you're saying, very
Yeah.
high in fiber, meats and uh, vegetables,
Hmm.
fruits. Not no one. I don't think I saw a single smoothie on that island. I don't think I saw, some of the things. Well, definitely not fast food. Not that I'm not a proponent of having some fast food, but if you think about what you're ordering, it is mostly soft. I'm going to add something here. I ate at McDonald's for 30 days straight to prove a point. And when I stopped that, I wrote down the things that I missed. And you know what was the number one thing that I missed? Crunch. I
Wow.
didn't crunch on anything the entire time, not even on a chip, So everything I ate was exactly what you're saying, soft, a soft sandwich, soft, everything was soft. There wasn't anything crunchy really in my diet that entire time I was eating there. So
Mhm.
that probably plays a piece of, mouth
Absolutely.
health.
Hmm. Yeah.
Yeah.
That is a fascinating book. The Blue Zone, and another component of that I see in my practice is you're talking about people eating dinner together and bonding and the teammates, kind of, and in the Blue Zone there the social aspect I think was also very different. They're working for their food, they're interacting, all the generations. I think one way that I see that in my practice too is um, I have a measurement called, well, you probably know this, the heart rate variability.
Mm-hmm.
I have a test to measure that on my patient, because if I do stressful procedures, I need to know if they're going to be able to handle the next stressor. And heart rate variability is, an indication of how much stress you've gone through for a long time. And I like to say it's like an indication of your actual biological age. But the point is that most people that I see are in sympathetic overdrive. They're not in that parasympathetic mode that, your blue zone
Yes.
people would be in,
Mm-hmm.
we're so sympathetic that,
Just clarify that a little bit for people who don't know what you're talking about, the difference between the parasympathetic.
oh yeah, sorry.
You know what
So,
I'm saying.
so our nervous system is controlled automatically. So it's called autonomic nervous system, but it has essentially two highways. One is the fight flight. Everybody's familiar with, adrenaline. We see a bear, we have to be ready to run. Heart beats faster, sends blood to the muscle, pupils dilate. So we're ready to, save our life, either by fighting or by running. But when that happens, it's not time to digest, restore, rebuild, detox, and all that. So we are not in the other side of, excuse me, which is the parasympathetic. So both of those highways control your heart. And if you follow the body's heart rate long enough, you can measure a difference depending which side of the highway your heart's controlled by. And the bigger that difference, the bigger the variability. And usually that means the healthier you are, because you're able to handle more stress, or because you haven't been, exposed to stress enough to reduce that variability.
Mm-hmm. Okay, so we do want greater variability.
We do.
And what you're seeing is most people are not having that because they're always in that sympathetic mode.
Yes, exactly. So
that comes right back to a lot of what I talk about with Share a Meal is taking that moment out and sitting down. So you're bringing your body back into that space while you're sitting there and eating and paying attention to your meal and socializing, which reduces anxiety, has you communicate with people around you. And that communication, that community is part of, it's not just sitting there that reduces your anxiety. It's also the interaction with people and that calmer level that brings you down. Am I correct about this?
All these words that you're using are like another description of parasympathetic. When you're calm, you're relaxed, when you're eating, when you're socializing, you're taking yourself out of sympathetic and you're going to parasympathetic. And the parasympathetic is when you digest, you restore, you rebuild during the night. That's when you do muscle or brain or memory consolidation, you detox. We're always on the other side. So that in itself makes your adrenaline goes up, your cortisol level goes, you're like all tense and you're not repairing, meaning you're becoming more toxic, your things, and that leads to like chronic issues. And in your world, maybe in like performance, I don't know if I can say performance issues, but
Yeah, absolutely. Because that directly relates to also, let's just turn this into the next phase of recovery, which is sleep. So what you are doing, how you are calming down at night, how you are sleeping solidly. I mean, I got to tell you, I'm a big proponent of sleep. If you saw my bedroom, you would see that the shades go down. It is black in here. There isn't a single, no alarm clock, no phone lights, no lights, there isn't a single little neon light anywhere found in this room. And it is cold. That's how I sleep. Sleep is super important. And that is the key, but it's also what you eat before you go to sleep. Some people believe they should eat nothing before they go to sleep. I think that you have to go to sleep with a little bit of something to sleep longer. And that is still a fast throughout the night. And I got to tell you something, intermittent fasting, I don't think people needed it years ago. We need it now because we don't stop eating. No one stops eating.
Well,
so we need to stake fasting.
Right. We didn't need it many years ago because we didn't have a choice.
Yeah.
And the biggest thing that people forget, like I always hear this thing about, we have to keep our glycemic index up. We have to make sure the sugar level, doesn't bounce too much. And, there could be something to say for that. But the problem with
Keep going with this. I love what you're saying. Go ahead.
the problem with people eating all the time. The real problem is not the sugar level. The real problem is people don't let their body the time to clean. When you're fasting, you know, in most of humanity, our body probably had 20 hours to clean up, meaning you're not eating for 20 hours, you gorge 2-3 hours if you gorged on a day, but your body cleaned the rest of the time. We need that time to clean. Break, fast, breakfast. That's what, you know,
That's what it was. You broke the overnight
right.
fast
And
when people slept longer.
People slept longer, and that's another really, really big topic. You know, I agree with you. Sleep hygiene has deteriorated our quality of life, and it's horrible. You know, like you're talking about the light, you're talking about the temperature, you're talking about food. Of course, sugar, you know, sweets, alcohol before a certain time, stimulants, of course, no later than a certain time in the afternoon will really wreck your sleep. Sleep hygiene is a really, really, really big deal. There's other, you know, there's also like, you could talk about Wi-Fi and cell phone signals. Like Earth has a magnetic field that affects us. We used to be nourished in a good way by that, and now that nourishment is disturbed by frequencies that are different and kind of mess up the good frequencies we used to get from Earth. And it at the cellular level, it disturbs the cell membranes. It actually has an effect on us.
Absolutely, it does. Yeah.
So sleep hygiene is a big deal.
I'm seeing you're wearing something on your wrist. What are you wearing?
I was charging my ring, but I have an Oura ring. So this is actually the Whoop.
You have the Whoop. Okay. Yeah.
Both of these devices are heart rate variability monitor. This one is more designed to give you sleep tracking. This one is for athlete. I'm not an athlete, but it tells you
can say you are an athlete. You perform every day and you need to perform at your best, right? Let's go. We're all athletes.
In that sense, thank you. Yes. But I'm not an athlete like your athletes, but I wish I was. But it tells you based on your sleep, how much you're recovered, and then how much strain you could do the next day. And, you know, pushing a little bit, but not too much and not too little to really get your results. So that's what that one's for.
So I don't want to take up too much of your time.
That's
and I
fine.
really do appreciate you being here. This is so kind of you. I mean, I'm loving every minute of this. And I love that we see so eye to eye on so many things. I mean, so I used to teach dental nutrition, believe it or not. Yes.
Fantastic.
And so I remember one main thing from that class that I taught, and it was that the number of exposures to sugar has a greater impact on your teeth than just sugar alone. So for example, that would mean if you are drinking soda, I'll just use this example, very slowly all day long, that is worse for your teeth than just chugging the can of soda and moving on with your day and rinsing your mouth out with water, right?
Correct. Yes.
The other one is gummy vitamins.
Yeah. Yeah. The sticky ones. Yeah. So the first one is because when you take the sugar, the bacteria in your mouth will transform that sugar into acid, and that will start demineralizing your teeth. But if you take a little bit, the acidity level will increase. But if you keep taking it, the acidity level won't drop. If you take it in one shot, you'll get an acid spike, but then your body will correct it, it'll go down, and then your teeth will be protected. So sipping for a long time, no bueno.
No bueno.
Yeah.
That goes for coffee too, right?
Yeah, unless it's you know, not sweetened. Like I do like a good coffee, and I do fast, so I do ketosis. I put fat in my coffee in the morning, but there's no sugar in there.
Okay. All right. And so I'm going to ask you to end my questions for you on is, what do you do at night before you go to sleep for your teeth?
For my teeth, I thought you were gonna say my sleep routine, but for my teeth,
No, I mean, this is what you do. I would need to know what type of toothpaste you're using, what kind of
okay,
toothbrush. Is it Oral-B? Is it electronic? Is it not? Tell me. I need to
yeah.
know.
So I do prefer electric toothbrush. So I use I prefer the Sonicare because it has more movements per minute and they're lighter, and they have brushes that the bristles are super super soft. I just feel like I get like a cleaning like when you go to the dentist. I prefer that, but the
Mhm.
Oral-B is great too. I kind of test toothpaste for companies, but they're always called holistic, so none of them have fluoride, and
Okay.
a lot of them actually have supplements and different nutrients for gum health and the gum tissues. I
Where do you
really like.
buy these?
Sorry.
Online? Where would you buy these?
Yeah.
Online? I mean,
So here are the brands that I like, if that's what you want to know. So
I kind of do, yeah.
I'm a big fan of the toothpaste called Rise Well.
Okay.
That has that hydroxyapatite. There is one called Revitin that has a orange flavor, which is a little different, but that one has actual vitamins in there that are really good for the gum. And another one that I really like is called Boca. That
Okay.
one is really flavorful, but it
Oh,
has all these good things in it.
do you floss every day?
I don't floss every day, but almost.
Okay,
Yeah,
okay. Thank goodness. There's a savior there for us. And
yeah.
is there anything else we should know about your dental hygiene at night?
Um, I think one thing I would say for that is that um, a lot of the dental hygiene is focused around vilifying all the bacteria in the mouth. And I think we need to remove the bad ones, but not um, remove all the bacteria. You need the good biome in your mouth. For example, if
Yes.
you're doing too much mouth rinse, you're killing off some of the good bacteria. There's a
Yeah.
study that showed they took healthy college students, some with and some without, so a controlled study, and 2 weeks of only changing the mouth rinse increased their blood pressure. Why? Because there are bacteria in your mouth that produce nitric oxide, which
Mm-hmm.
increases blood flow, and they killed those bacteria, and that led to a slight increase in blood pressure. So,
Amazing.
yeah,
I mean, I love that you're saying that too, because one of the crazes is always detoxing your body, detoxing your body. And you can't detox your colon. You need the bacteria in your colon. I'm coming from the other end. That's my end, the nutrition end. So you need bacteria
yeah,
in your
you
colon as
do.
well. You
Yes,
do. And but you need the
yes.
good bacteria there, but you don't want a clean colon. You want those bacteria. So that starts from the mouth all the way down through the entire digestive system. So I'm glad that you said that. That means a lot, and it makes a lot of sense. We need to start listening to you, Dr. Pascal. You've got it. I
Thank you.
appreciate it.
I appreciate that. Yeah.
So we all know what to do tonight. Brush our teeth. You don't have to floss tonight, and and eat crunchy food. Yes.
Yeah.
Yeah.
Yeah. Don't be afraid to eat, chew your food, well, and food that needs
Yeah.
to be chewed.
Thank you so much, Dr. Pascal.
You're
I hope you
welcome.
have
It's
a
a
great
pleasure.
night tonight. Thank you.